And Megan, I'm going to rely on you to keep an eye on the chat. All right, welcome everyone. Thank you for joining. This is the annual report of the Hamilton County Addiction Response Coalition, formerly known as the Heroin Coalition. We changed the name because, as we all know, addiction isn't related or relegated really to one drug. And so we changed our name last year. So this is our annual report. As always, the experts are on the line. I'm going to introduce everyone that serves on HCARC because the work of this committee is so important. It's ongoing. We meet frequently, especially since COVID. And everyone is so committed to this work. And so I personally want to give a big thank you to everyone and make sure that everybody knows who has been working on this committee for the last year and really beyond. So I'm the executive chair of HCARC. John Young is our director. I guess when I say your name, just a little, give us a little wave. The program director is Megan Gosney. Megan is the one that organizes all of us, and Megan has done a spectacular job of organizing the annual report this year. So a big shout out to Megan. Thank you, Megan. As you know, we're formed in 4 different committees. So the Prevention Committee is led by Nicole Schisler from Prevention First and Leah Dennis Ellsworth from UMADOP. Treatment Committee is Neil Tillo from Talbert House and Pat Tribby from the Mental Health and Recovery Services Board. Interdiction Committee is Chief Tom Sinan from the Village of Newtown, District Chief Carstel Winston from Cincinnati Fire, and Trina Jackson from the Hamilton County Office of Reentry. Harm reduction includes Dr. Jennifer Mooney from the Hamilton County Public Health Department and Sarah Bolton, who is with the Health Collaborative. The Faith Committee is Reverend Leslie Jones from Truth and Destiny Covenant Ministries and Reverend Dr. Alphonse Allen from Allen Temple AME. And our Business Committee is JB Bussey from Loth Holdings LLC. And recently, Bob Castellini Jr. was on that committee. He retired last month, but we do want to include him and thank him for his work. So we're going to click through this annual report. I'm going to give an opening statement and then turn it over really to the experts from each of these committees to report out on what they've been doing over the last year, which has been an extremely challenging environment, and what our vision is for the upcoming year and beyond that. So, as the COVID-19 pandemic tore through our nation, bringing new challenges and changes to our very way of life, the epidemic of addiction did not take a break. Pandemic-related stress and isolation made the difficult work of HCARC even more difficult in 2020. Despite those challenges, the members of HCARC continued to innovate and collaborate to restore lives in Hamilton County. The HCARC is an action team that connects people to the right resources and treatments. We address addiction through comprehensive solutions. This inter-system cooperation is built on 4 pillars: prevention, treatment, interdiction, and harm reduction. These pillars represent the areas of expertise of those serving on the subcommittees of the HCARC. Additionally, we have engaged local governments, the business community, hospitals, and the faith community to help strengthen our work. The following document, the HCARC Annual Report, was created using information provided to us from the coalition members to give the Hamilton County community insight into the magnitude of the problem of addiction, a better understanding of the work of HCARC and its partners, a synopsis of what strategies have led to positive outcomes, and an overview of what we hope to accomplish in the coming year. A special thanks goes out to the Hamilton County Board of County Commissioners for their ongoing support and commitment to addressing the addiction crisis in our community. And so with that, Megan, I'm going to leave it to you to advance the PowerPoint and start with the Prevention Committee.
Good morning. My name is Nicole Schisler, and I am the president and CEO of Prevention First. I am the co-chair of the Prevention Committee with Leah Dennis Ellsworth, who is the executive director and CEO of UMADOP of Cincinnati. Prevention First and UMADOP share a common goal of providing evidence-based prevention to make our communities healthier and stronger. In 2020, the Prevention Committee worked to build awareness, engage and partner in the community, and provide opportunities for individuals to decrease access of unwanted or expired medication. The Prevention Committee continued to connect with faith-based organizations and community partners by offering drive-in movies, which included prevention messaging and free popcorn. Church navigators provide messaging through weekly phone tree updates, flyers, paper fans, Bible studies, and sermons. Coordinated by the UMADOP prevention consultant, the faith-based community of New Prospect and Christ Temple Church implemented parent training and social emotional learning youth classes for grades 2nd through 5th grade to address COVID-19 and student academic gaps. The Prevention Committee has maintained partnerships with local hospice organizations and transition centers to distribute doTERRA bags for safe medication disposal. A doTERRA bag can be filled with up to 45 pills, and when filled with water and sealed, disposes of the medication safely and can be discarded as trash. doTERRA bags can be requested through Prevention First. The Prevention Committee promoted the Take Charge Ohio campaign, which is available in partnership with the Ohio Department of Health. The Take Charge Ohio materials encourage the safe and responsible use of pain medication to help minimize the risk of drug misuse, dependency, and addiction. UMADOP and Prevention First implemented a professional development plan to increase prevention credentialing as a growing need to have culturally and race-specific certified prevention instructors in the field of chemical dependency drug prevention practice. In conclusion, substance abuse prevention is most effective when individuals, families, and communities come together to design and implement strategies that prevent or delay the onset of behavioral health problems. For more information about the work of UMADOP and Prevention First, please visit our websites at cincyumadop.org, that is CINCYUMADAOP.org, and prevention-first.org. Thank you.
Thank you, Nicole. All right, we are going to go to our next subcommittee, which is the Treatment Committee.
Good morning. My name is Pat Tribby, and I'm CEO of the Hamilton County Mental Health and Recovery Services Board. And under statute, the board receives state, federal, and local funds to support treatment programs in our community. I'd just like to highlight a recent round of funding, especially on the federal side, that it is really characterized by what is called SOAR funding from the federal government to the state to the board. And this has been a very successful round for us in terms of trying to support the needed treatment programs in our community and to allow us to not only support existing programs, but to enhance some of the programs. The money that we received is about $6.4 million, and that will support programs to 11 contract agencies, over 23 projects in the community, which we're very excited about. Key to this is maintaining some of our existing programming, obviously, and one of the key components there is our very successful engagement center. The funding from the federal government will help continue to support that, and it is really a vital link in terms of the treatment continuum that operates in our community. Additionally, some of the money is going to be used for expanding peer services, continuing to provide medication-assisted treatment in our community and to help that grow, and also to provide outreach and engagement services to help the underserved and minority populations get a better understanding of recovery and begin to access our services in the community. And finally, hopefully this will help us continue to sustain and grow recovery housing. Treatment programs are important, but all of our clients, like you and me, would like a job, would like a nice place to live, and recovery housing is part of that and a very critical part of it, but a piece that needs additional growth in our community. So we're pleased to announce that funding, and hopefully we'll again maintain and continue to grow our programs in the community. Neil?
Well, good morning. Let's make sure I'm off mute. Neil Tillo here. I work at Talbot House, and we have the responsibility and actually the honor, if you will, to run the engagement center. We got it up, stood it up not quite 3 years ago. It started as a 16-bed facility to deal with the post-overdose cases in our community, those survivors who needed immediate responsive care. It has been, in my feeling, is an overwhelming success. And we grew from 16 beds to 20 beds because of the funds that Pat talked about. We are also increasing the level of care that we're providing there because in the past, we have not taken folks who have methamphetamines and alcohol and other kinds of drugs in their system because of the difficulty of transitioning them through a detox process. But these new dollars that coming from the Mental Health and Recovery Services Board will allow us to deal with that and maybe even expand the beds by a little bit. So we're really pleased where we're going. One of the key issues here is too, how do we continue to follow these clients up? You know, recovery is a process, it's not an event, just like many other medical interventions. And so we're really hoping that this will be the case with recovery coaches and Pat mentioned the continuum of care that's so important. So recovery housing and outpatient care and whatever other care is necessary, just like we did for any other disease. So as a heart attack, they don't just go in and have surgery, they have rehab and everything else. They change their diet, they get into physical exercise or whatever their doctor recommends. The same thing is true with addiction. So that's a big piece of it. The other thing that's happened this past year is that the board was able to provide a great deal of Narcan distribution money to us, to the community to provide, and we have thousands of doses of Narcan that have gone out. We're getting ready to partner with the Healing Communities group that's doing a major project to distribute Narcan to people as they leave the Justice Center. We're also working on some Justice Center and other kind of recovery housing, Narcan, peer recovery coaching efforts. And along the way, we're still working with our African American engagement work group that's so important in targeting neighborhoods like Avondale, Lockland, Bond Hill, and Avondale to try to focus to make sure that the African American community is getting the access to all the care they need as well. So it's been a very fruitful year, even though COVID is swirling around us. As Dee said, the epidemic continues, but as you'll see later, Hamilton County is making better progress than most. So thank you, everybody.
Thanks, Neil, and thanks, Pat. We're going to move to interdiction.
Good morning, everybody. Tom Siney with the Newtown Police Department, and I am one of the co-chairs of the Interdiction Committee. Every year, our coalition looks to the Hamilton County Coroner's Office and asks for suspected overdose death data coming out of the past year. And I want to clarify before we bring that up several points. One is that this is not final information. It is important to understand this is suspected. And for that final information, which will probably be coming out in the next couple of months, the Hamilton County Coroner's Office would handle that final report, that final information, and also report on any trends that they're seeing or drug trends that they're seeing in toxicology reports. So I want to make it clear that this is not final, but we use this report to kind of give a baseline. We're following many different data points and we do see trends. So we look at this report because we believe the coroner's office probably paints one of the most comprehensive pictures in our area and gives us an idea of what is happening in our local region. At times, they will even include others from different counties that had an incident here in Hamilton County. It does impact the rest of us. And also, I want to make sure that everyone understands that when we bring up this report, those are not numbers. Those are people. And it is never lost on any of us in this group or the community or the coalition that those are people and they leave behind friends, families, and loved ones. And it's what inspires us to continue to ask ourselves, what more can we do and what can we do better? So with that preface, Megan, if you don't mind pulling up some of that information. Again, this is suspected, this is not final, and I would leave that up to the Hamilton County Coroner's Office and Dr. Samarco when they get that final report to come out. This could go up or down, but it does give us some sort of a baseline. And when you look at this information, number one, again, this is a person. So it is tragic. But when we look at this and try to figure out, is there any kind of silver lining in this? We as a group kind of looked at this year coming out of 2020, the year of COVID, and thought, what is a silver lining? What can we get out of this information? And part of that would be that although it is anticipated, and again, not final, that Ohio may see an increase, there's been some reports that they had spiked 22%. Hopefully that levels off in the final numbers. The CDC released national numbers of over 81,000. Now that was not a January to December, that was a 12-month period, but it did show an increase. I think the silver lining with this is especially a challenging year, as the other members said, and you will hear from others, that coming out of COVID, it was extremely difficult. And for us, hopefully keeping fingers crossed, barring any unforeseen data or circumstances, for us to come out stabilized or slightly down is a testament to this coalition. And not just the people on this call, but our community members. This group had the insight to understand from the very beginning, when we started getting reports as a country that there was a virus coming out of Wuhan, China, that was not only important because of the virus and the damage that would cause, but that Wuhan and China historically has been a major manufacturer and distributor for fentanyl and fentanyl precursors across the world. This group picked up on that early and understood that a disruption in the fentanyl supply of any type, whether it was lockdowns from countries, whether it was dealers holding on to that, any disruption in a fentanyl supply would be significant and cause problems with those users who use fentanyl and overdoses on the back end. It seems counterintuitive. You would think that we would want a disruption in fentanyl supply. If we had the factor that it would completely stop it, or everyone is in recovery and not using it, that would be great. But if that's not the case, what we understand is tolerances go down. And when those supply chains open back up, we will see an increase of overdoses and deaths. This group picked up on that. We transitioned from quarterly or biweekly meetings to weekly meetings, and we actually planned pre-lockdown and post-lockdown. What could we do as a group to negate some of these issues? And I think that's the power of this group. Although we cannot control external forces, what's in the drug supply or a virus, we can work to minimize or mitigate that damage. And I think that's what you saw from this group, having that planning pre-lockdown and post-lockdown and working hand in hand. And an example of that is the information sharing that we do. The coordination, the collaboration, and information sharing was critical. And I got to point out a couple of our strong partners, the Hamilton County Health Department Exchange Program, as well as Hcr. We were able to take information that we were getting from a law enforcement perspective internationally and nationally, pass it on to the exchange program and Hcr, who are working directly with people, give them that information. They were then able to plan and pass it on to those that are using in the community. But because of their incredible relationships with them, we were getting real-time information back from people on the street who were telling us what drugs were out there, what some of the trends were, and we're able to pass that on to this group and make plans. I am convinced, and hopefully everything stays the way it is, we continue this trend in the final numbers. I am convinced that that is a testament to the coordination, planning, information sharing of this group, and why we were able to come out of those tough months of April, May, and the beginning of June and begin to adapt and recover more quickly and be able to stabilize. As far as the Interdiction Committee, we look at ourselves as kind of that link between all of the partners and the human beings, and that information sharing will continue in 2021, along with the connectivity of the partnerships. We will continue those long time held programs such as the Heroin Task Force, which we cannot forget the critical work that that group does. Even during COVID, they were working on trying to find those people that are pushing these dangerous drugs and contributing to the overdoses and deaths and taking those dealers off the street. Their work is critical, and we thank them for everything that they're doing. You will also see the One-Stop Resource Center coming out of COVID. We're looking at the beginning of April, so look for an announcement here soon that in the beginning of April, we'll relaunch that. That was a program before we went into COVID, had connected nearly 200 people to a resource. Everything from treatment to, and to us, this may not seem like a big deal, but it is. Connecting even B&V to get a license helps people in longer term recovery. So we're looking at relaunching that program. You're going to see from the Interdiction Committee not only an expansion, but of evolving of programs. And one of those will be the quick response team. The quick response team in Hamilton County is the largest law enforcement-led quick response team in the country. You will not only see an expansion of personnel, but also of services and its reach. It will transition from not only post-overdose, but pre-overdose. And we're actually going to look at that as being a link to connect more people to our coalition partners and help fill in the gaps and follow up. So when someone falls out of the system, there'll be someone there to catch them and reconnect them. And that's kind of the belief of a new initiative that we'll be launching hopefully in a couple months. It's still in the development phase of a hotspot response. How can we go to these traditionally neighborhoods that have been the hotspots that we've seen with overdoses and drug use and try to connect the pieces, use actionable data, and get more people back into the system of care and keep them there. And the goal with that would be reduce service calls for Cincinnati Police and Fire, along with reduce overdose and deaths. And you will also see the LEADS program, the Law Enforcement Diversion Program, expand. And I want to give a shout out and a thank you to our longtime partners where the LEADS program will be going to, and that's the Norwood Police Department and the Colerain Township Police Department, who for a long time have been partners with us. And we thank them for that partnership and also their leadership in taking on the LEADS program in their communities. So when we talk about the interdiction and the innovation, the evolving and expanding, one of those programs is from the Cincinnati Fire Department. And I'm going to turn it over here in just a second, but I want to make sure people understand that the Cincinnati Police Department, Cincinnati Fire Department, the city of Cincinnati, from the beginning have been longtime partners with this coalition. They worked side by side with us. And to show you the innovation, I want to turn it over to Chief Winston with Cincinnati Fire Department, who will be announcing a program that is not only innovative, but we're very excited to be part of. Chief Winston?
Good morning, everyone. Again, my name is Carstel Winston. I'm with the EMS Bureau of the Cincinnati Fire Department. And as Chief Simon talked about, we are developing a new initiative it's called ET3, and it's a really initiative for addiction treatment. And what we plan to do is to focus on stable opioid overdose patients and really to provide alternate transport destinations for them. Because normally the typical, once they go down, we treat them, normally they get transported straight to the emergency department. So in this model, what we'll do is we will partner up with an addiction treatment center, the Talbert House, really to help provide a 24/7 evaluation and enrollment for patients who are deemed appropriate to bypass the traditional emergency department. Now, first of all, we'll be working with our medical directors to make sure that we have a specific protocol to clear those patients. But once we have found that their vitals and everything is stable, we can enroll them into this program here. And really, these addiction treatment centers are ideal for us because so many of our patients go to the ER where they really don't get the help they need. So instead, if they want and desire to get that help, we'll transport them straight to that addiction treatment center. And really, it will be really a good thing that we're looking forward to. So as a fire department, we view this initiative as really a patient-centric program, really trying to get that patient the needed help they can from this addiction treatment center. So we look forward to hopefully getting that up and running by this summer.
Great. Thank you. Thank you both. Hey, Megan, put that chart back up real quick, will you? So just wanted to reinforce what Chief Synan had said. So that number there is 432, and we do not believe that's a final number. It may bump up just a little bit when we get the rest of the information in from the coroner's office. But to have a trend that did not go up during the pandemic, as it did in so many communities, it is an achievement. It is a sobering achievement because we still lost over 400 people in Hamilton County. But during the time of a pandemic, when so many people were isolated and felt disconnected, our community stepped up. through this commission and through this coalition and through the agencies that provide services in Hamilton County. And so I don't think we can say it enough that these organizations are nimble, they were responsive, and they tried to provide services, whether it was virtual or distanced or whatever it was. We were trying very hard to make sure that we continued to help people that are in recovery in Hamilton County. So I just want to emphasize that because this graph, I think, is an illumination of that. We are going to turn now to harm reduction.
Good morning, everyone. I'm Jenny Mooney. I'm an assistant health commissioner here at Hamilton County Public Health, and I have the privilege of co-chairing the harm reduction committee with Sarah Bolton from the Health Collaborative. I'm going to talk a little bit about COVID and harm reduction, and the intersection of those things provided lots of paths for innovation, specifically for harm reduction staff. We have a lot of great partnerships. Our harm reduction division here at our health department has fully been developed. So we have a really robust team of folks now who are really out there trying to stay engaged with people. And I think 2020 was a great test to how connectivity and connection to people is just critical. So this data that you just saw, I think, kind of illuminates like all of the great efforts that were going on and are continuing to go on in this sort of hopefully post-COVID landscape. So harm reduction services in 2020 were greatly modified due to the pandemic, with distancing, inability to be out in the community, especially during the quarantine period. It called for technology in many ways. So our team began texting for Narcan. They began a project on fentanyl test strip distribution with some local bars and restaurants, where it kind of hit home for folks that, hey, we have staff that have suffered overdoses. So this is not just about other people. These are about our people. So that project has been successful. And then syringe services information, they are also navigating through that by doing texting on locations and trying to stay engaged. So our public health staff have worked to really maintain client engagement, promote linkage to care and treatment and other services. So during the quarantine era of 2020, we provided fewer harm reduction supplies in the beginning, and because we served fewer people. The team got innovative with doing appointments. They actually struggled to get some PPE to get out in the community. And then once things kind of opened up in the summer, they started resuming normal operations. And currently we're serving the same amount of clients that we served pre-pandemic. So we feel like things are pretty much back to normal for that most part, but we still kind of rely on these technology pieces that came about during 2020, and they've been pretty important in maintaining that client engagement. Another really interesting project that came out during 2020, as a lot of other folks have talked about, this promoting peer support. So we're trying to really redefine and change the narrative about what harm reduction is. I think for many years, it's been associated with Narcan, rightfully so, and syringe services. But I think our team is really trying to take a step back and say, you know what, harm reduction is sort of a life course perspective, and it extends beyond periods of active drug use, well into treatment and recovery phases. And so we look at it as sort of the ultimate form of harm reduction, is promoting success in those folks who have already successfully moved into recovery, and they may have capacity to provide mentorship. So with funding from the Center for Disease Control and Prevention, this past year, we partnered with Easter Seals to develop a workforce development program that provides an avenue for people in recovery to obtain peer certification, job and life skills training, a paid internship, and then job placement. And this was wildly successful. So this was a year-long project, and within the first 4 months, we met 80% of the annual goal for recruitment. So this is really pretty amazing because it shows that there are peers out there, but they need to be work ready, and we have partners who are ready to take on these folks with living expertise. So this is just a great testament that recovery is actually a form of prevention. And then finally, moving on, I just want to note that in 2021, we have had significant changes in our data reporting from the previous years. The state has actually moved to new and more robust data systems. So it was Epicenter, and now it's Essence. And we're closely working with our partners at the Ohio Department of Health to ensure that data is moving and transitioning between those two systems appropriately. So once all historical data on the state level are transitioned, then we will be doing the same thing with ours. So if you see changes in some of the data that you've seen in our daily reports, these are sort of aberrations in how reporting is happening. Our EPI team has been taking a careful watch on all of these metrics, and they use all kinds of statistical methods to compare trends from this year to last year to make sure that we're not missing anything. So far, luckily in 2021, we've only had one day where ED visits have surpassed statistical thresholds. And typically when we issue an alert, our statistical team will note that we have seen aberrations for a couple of days during a 3-day period. And then we would bring that to the Hamilton County ARC to discuss what our next step should be. So I'm hoping that we're continuing to see this a positive trend as we move forward into 2021. And I'll turn it to Sarah.
Thank you, Dr. Mooney. Good morning, everyone. I'm Sarah Bolton with the Health Collaborative. So tacking on to what Dr. Mooney shared, the Health Collaborative is really excited to work with the hospitals and health systems and other providers in the greater Cincinnati and Hamilton County region on redefining harm reduction. So under the leadership of Hamilton County Public Health, we are excited to get to really build out that definition more holistically. And an important part of that we are going to dig into in the coming year is around trauma-informed care. So understanding the overwhelming trauma that healthcare workers, but really the general public have experienced over the last 12 months of this pandemic and will continue to experience for many years to come. We think it's really critical that we embed these important tenets of trauma-informed care throughout the healthcare system so that folks and specifically providers can meet people where they are and help work through this, what we anticipate to be a rather large mental health crisis in the coming years. So really looking forward to partnering on that. And that's all I had.
Thank you, Sarah. Thank you, Dr. Mooney. All right, we're going to move on to the faith community.
Good morning. Thank you, Commissioner Driehaus. I'm Pastor Leslie Jones, and I co-chair the Faith Committee with Reverend Dr. Alphonse Allen of the Allen Temple AME Church. As we know, addictions and these issues bring trauma, bring a lot of emotion, and recovery really encompasses the whole life of an individual, including their mind, their body, their spirit, their community, the people they're connecting with, and how they connect. And for many, faith is a very critical part of recovery. So the Faith Community Committee helps the coalition to raise awareness and use their compassion and local understanding to bring hope and healing to those in need. Through this time of COVID, we certainly have experienced a great deal of the need for pastoral care, not only as a result of what the pandemic has done by way of people, losing family members, losing friends, but also helping people to understand that there's other ways to cope. And so we have extended ourselves simply by offering that pastoral care, not only to those that are in recovery, but those that are also working on a daily basis with people in recovery, as well as those who are providing medical and health care to those individuals. So we can go to the next slide. One of the ways that we have done that is through training. We have participated in 3 trainings to help faith leaders to better understand what harm reduction is. Harm reduction is a way for, or aligns very well with spirituality in helping our community members, as well as our church members and faith community members, to understand that all people are the beloved of God. Even those who may use drugs, as well as those who are in recovery, or those who are supporting people who are in recovery. So with these trainings, we have learned the foundations of harm reduction, engaging people who use drugs, and overdose prevention, and a good response to that. And so our goal in 2021 is to present the 101 training for more faith leaders in our county and throughout our region, and to people of faith. We can go to the next slide. As I said, one of the things that we do as the faith community is offer that support and help raise awareness. And so we've done that by helping groups to understand how faith is a very big component and can be a part of not only harm reduction activities, but offering the support that is needed to be that listening ear, to be that place that can also distribute. We've had services where we've distributed Narcan. We distributed doTERRA bags over the summer, over last summer, as we were also disseminating information. Many of our churches and faith communities distributed lunches for families and for children. And in that, we put some flyers to help people to raise that awareness about what are you doing sometimes with medications. Are you disposing of those medications properly? And so by doing things like that, that helps us to raise awareness. Many of our groups also have prayer calls and ways that they are extending spiritual development into our community. And so on many of those calls and a lot of that work that is done, spiritual work that is done, as you can see in the center of this slide, is through prayer. And so we've held some services through the last month of August. We participated in the National Overdose Awareness Week, and we held prayer and services in many of our local faith communities to raise awareness, but also to pray for those who are people who use drugs, as well as people who are in recovery, and those who work with individuals who are using drugs or in recovery. We think that that is a very, very important part. And we would even like to say that is also, our prayers are being heard and answered. So that is why we're also seeing some reduction. And we did not see maybe the elevation that we could have seen like some other communities in those numbers, because people are praying, people are extending and changing the stigma. That is a big part of what we're trying to help faith communities to do, is to change the stigma around people who use drugs, or around the community that works in recovery. So in 2021, we hope to create a faith roundtable of clergy and congregational representatives to hold quarterly meetings to talk about what we're doing, and to also extend to them other supports, to help recruit congregations to host addiction awareness events within their congregation, and also to expand our committee and our outreach. So we're grateful for being able to sit at this table. Unlike those who work in this profession on a daily basis, as faith community leaders, our profession is to uplift our community through our faith and through spiritual practices. And we see harm reduction as one of those spiritual practices that we can, or could be a spiritual practice that we can help this community, and particularly this coalition, to continue to improve in the area and enhance the lives of those who are being impacted by our work. Thank you.
Thank you, Reverend Jones. And then the last committee is the Business Community Committee. JB Buzzy could not join us this morning, and so I'm going to deliver this, and I will be succinct. So this, like the faith community, is a fairly recent committee of Hcr, but so important that we are connecting in both of these ways. And so we have tried to engage the business community, because they are part of the solution as they look to employ people who are in active recovery and retain people who are in active recovery. And so we've got a couple corporations in our area, Nehemiah Manufacturing is a shining example of how this can be done, where they are intentionally hiring people who are in recovery, knowing that there may be some challenges for that individual related to employment, and providing support services on site for those individuals so that they're successful in their jobs at Nehemiah, and also can spread the word and tell people that this is a space that's welcoming, it's inclusive, it's embracing of all kinds of people, and they are not judging folks when they walk through the door, and in fact, trying to help those folks stay in active recovery. And so it is a great example for the business community to emulate. And so we've done some forums with business owners and HR professionals, because there is an HR component of this as well, in conjunction with the Chamber of Commerce. And so the expectation is that we will continue that work and try to get businesses to think about whether or not they can afford to have those kind of support services on site, or perhaps they're smaller than that, and that's not realistic. They can join forces and say, maybe 5 businesses can share the expense of one support service provider, and then have that available for their employees. So it's kind of a new concept. It has been very successful at Nehemiah, and so we are looking to expand that model throughout the county in conjunction with the business committee, and especially with the Chamber of Commerce and the CRBC. So that is the extent of the annual report. I know there's been a little bit of back and forth about getting a hold of that, but we will email it out to everybody that's on the call after the meeting. I'm going to rely on Megan and Alex to do that. And this is also going to be hosted on the county's website. So again, thank you all for participating. Thank you so much to the committee members. The work is inspiring. I mean, it's just inspiring that this work continues at this level, with this level of enthusiasm and diligence through Hcr in Hamilton County. So with that, I think we're going to open it up to questions. And Megan, I'm going to rely on you to facilitate.
I'll take it from here,
Alex,
Commissioner.
sorry.
To our members of the media who are here, if you just raise your hand, and we'll recognize you in the order that your hands go. Our first question is from Terry DeMio. And Terry, you should be able to unmute yourself now.
Can you hear me?
Yep. Good
Yes.
morning.
Hi. So this is kind of a comment question thing. Over the years, I've seen dramatic growth, obviously, in large part because of your progress, and just, wildly, a lot of progress in understanding people who use drugs, understanding the chronic disorder of addiction. I guess I would love if one of you can kind of talk, maybe Neil Tillo, someone from treatment, maybe John Young, I don't know, can talk about how you as a body needed to grow and learn together as well in order for you to get to this point. Do you know what I mean? I feel like you all came together with the right ideas, and maybe you can just answer, do you have a greater understanding? Does harm reduction make more sense to you now? What have you seen in the change in yourselves that might be reflective of what's happened with your group and in the community? I don't care, whoever wants to answer.
Terry, this is Neil. Yeah, I think it has been that it is the secret sauce of the coalition. There's no doubt about it. I think having the way law enforcement has stepped up in recent years with Tom Simon, Tom Fallon, and so many other people, law enforcement, Cincinnati PD, to see that we have to treat the problem and not just arrest the problem. And the way the fire department has stepped up incredibly with the QRT and with all the things that Chief Winston talked about. And I think it has broadened our perspective and appreciation for each other. I think having champions, I have a greater appreciation for the challenges in law enforcement and see it in a much wider view. I think the community members who are faced with addiction, family members and users themselves have a better appreciation for how law enforcement and harm reduction and how public health has been so fantastic, how they can intervene with all the needle exchange and everything. I mean, that was a great, courageous effort by public health, Hamilton County Public Health, to start the needle exchange. I was stunned that it got support over time, and really encouraged. It gave me great appreciation how we work together. So I really think the 1 and 1 and 1 equals 10 instead of 4 because of the synergies of the group. And I'm not just saying that, I mean that sincerely. I mean, QRT is a great example of it. The needle exchange is a great example of it. Now it's happening in the engagement center, or just everything that the working with the faith communities, things that, we all talked about a little bit, we're really doing now. The last few years, it's really occurring. And I think that drop in rate in Hamilton County compared to other places, almost every other place, the state of Ohio's rate went up of overdoses, and ours is going to go down, almost certainly. I think that is a direct correlation to the working together and trusting each other a little bit more, and really trying to embrace and understand what everybody's trying to accomplish. So I'm a big fan, obviously, and I was here from the start of it when Commissioner Hartman at the time started. Denise has done such a great job providing the leadership and keeping everybody headed in the right direction. So I think we've got something special going on here.
Thank you.
Thanks, Terry.
And our next question is from Marielle Carbone. And Marielle, you should be able to unmute yourself.
Hi there. I have two quick questions. I think the first one would be for Chief Synan, just specifically about some of the numbers you went over, because I know you had mentioned that once the pandemic started, you guys started all coordinating a little bit more so that you could figure out how to tackle the pandemic. So I guess the question is, I know we did a story with you that March, April, May, we were seeing some alarming overdose deaths. How did the numbers drop, I guess, after that compared to the first half of the year, to give a better picture of that coordination and response, if you have those?
Sure. I think we talked about as a group going in, when the virus first started, there was a deep recognition from this group that Wuhan and coming out of China was significant. We understood the importance of those locations with fentanyl precursor distribution and the fentanyl supply. And look, this is not a surprise to any of us in this group or anyone working in addiction, and we've seen it in other areas where there's been a disruption in that fentanyl supply. We know that there will be the tolerances will drop with those users. When that fentanyl supply comes back out and fully online, that we will see an increase in overdoses and deaths. You see it with people coming out of jail. So this is something that this group was fully aware of. It was brought up early on that this could be an issue. And you look at any member of this group and they have a huge network. And that is also the power of this group, is having that huge network. We were able to talk directly and ask questions with the Office of National Drug Control Policy. They asked us questions, what was going on. So that sharing of information on that level and then bringing it down to the community level really helped us. And I got to say, we knew going into April, May, and June, when those lockdowns would start opening up, that we would see an increase. I think our hope was that, can we mitigate and lessen some of the damage? And I think for many of us, we went into this conversations feeling a little helpless because as external forces play a major role, we cannot necessarily control the fentanyl distribution. So we were very concerned, but I think what it did, and to Neil's point, it really galvanized us to formulate a plan. And I can tell you from someone as an insider, you heard treatment talking about how can we adapt? How can we work in this COVID environment? How can we come out of this fentanyl disruption? You heard it from prevention. How can we get information out to the community? Many won't know that Megan worked very hard on information, put it out into the community beforehand. This was all a concerted effort, and there really was a direct path, a conscious effort, and a line for every step we did. We knew April, May would be tough, but I think what we all hoped was that because we planned, because treatment, prevention, harm reduction had all planned, and we're working on how do we adapt and how do we come out of this quickly, we were able to recover more quickly. So I think that was the key. Knowing beforehand, recognizing that a fentanyl supply disruption was important, just as important as the virus with the impact, planning for how do we come out of that, and then being able to adapt and recover really is a testament to this group. And let me say this, look, there is no celebratory mood in this group. Let's just say hypothetically 432 people died in Hamilton County, and that ends up being the final number. It is 432 too many. And that's what really drives this group. And that was the thinking behind the planning. And again, to Neil's point, it was that this group coming together, we've worked together. And I'll give you another little inside information. We are passionate and we clash at times. And I think that's important because we are so passionate about what we're trying to do and get that out there, that having that truth and honesty allows us to come out of this better prepared and planned. So what it was recognizing fentanyl supply disruption, pre-planning for pre-lockdown, pre-planning for a lockdown, coming out of lockdown, and being able to adapt and recover is what really allowed us to stabilize.
Thank you. And
Did that answer your question?
Yes, that was great.
There was a lot there. I'm hoping it answered it. Sorry about that.
One more quick thing, I think, for Jennifer Mooney. You had mentioned a couple different ways you guys adapted during the pandemic, from more client engagement with linking to care. And I'm just reading through my notes here. So some of those different ways you did that. Is there one way that you would highlight that you think was the most important and most successful for you guys in some of these overdose preventions through some of those efforts you mentioned?
Oh, I don't know that there's one way, but I think the one little thing I will highlight, what we just talked about, what Chief just mentioned, is even from revising language on the alerts, we really took a different approach at trying to talk to people rather than alerting systems like we typically have in the past. We really wanted to drive it home like, hey, folks, we're talking to you. And if you need help, help is still out there. And they were still connecting. I think that was really kind of interesting because we were all going through COVID too, right? Everyone was. But I will say that the team was incredibly innovative during a period of total fear. We're human too. We were going through the pandemic, but we were also realizing that we can't lose touch with people out there. And everyone who might be quarantining, who might be sort of hunkering down in their own ways, we still needed to kind of keep that connection. So I think, them getting out there by appointment, setting up cones, creating safe mechanisms, right, for syringe services, for example, maintaining a positive attitude and still going out there every day and meeting people where they were. I mean, I have to hand it to them. Those were some scary times, and they got out there and they still did the work. So they were amazing.
Thank you. Alex?
Our next question is from David Winter. And David, you should be able to unmute yourself.
Great. Are you guys able to hear me?
Yes.
Okay, great. So first question, I just have a couple. The first one, though, is for Chief Winston. Chief, can you go into a little bit more detail about this diversion to Talbert House program? What would happen, or what is happening now when people are going to the ERs? And do you think that there's going to be, and maybe Ms. Bolton would have a better idea of this, but will there be any pushback from the ERs saying, no, you really do need to bring them here? What did happen, or what is happening now, and how is this going to help in the future?
I think, just to clarify, this would be strictly those patients who would request help. If they were down and they didn't fit into our medical protocol that our medical director had set forth, then we would still transport to the ER. But UC, we're working with Office of the Medical Director there at UC, they fully approve this, and they, because so many of the times the patient will end up walking out of the ER and they just haven't gotten anything. So if they want to get the help, we will transport them right there to the addiction center to get that help. But it really, so many times they do end up walking away or just not really getting anything, because once we bring them back, they just get checked out at the ER and then they leave. So this point, they can at least try to get the help that they really need by being transported there.
Okay, and then beyond that, and really, I don't know whether Jennifer, you're the best one to answer this question, but a lot of you talked about needing to adapt during this time of COVID. What is going to stick that you adapted and you went, okay, this actually is working better than what we were doing before?
I think for us, a lot of the technology pieces are definitely going to stick. I do hope one day we can resume in-person meetings, but I do think that using technology to maintain client engagement has really been critical. Receiving daily alerts on where services are going to be. There's also a great technological format that our team has put together. When we hired certified peer support specialists, they have created a like a forum, an online message board. And it's sort of a way to where you can sort of scroll through a bunch of different links and different threads to find resources for people who are in active addiction, in maybe treatment and recovery. So, you know, it's led by one of our peer supporters, and it's a way for people to engage where we're in periods where we can't, right? So I think a lot of those pieces are definitely going to stick. And it just kind of creates more pathways for innovation. Another one was they created an app that should be released to provide any layperson the know-how on how to address a potential overdose. And you literally will start the app, you set your phone down, and it will guide you through addressing a potential overdose. So I think that we've been very, very fortunate to be at least in an era of technology while we're in a pandemic, and those things will definitely stay.
And then Leslie, you had mentioned and it's so true that faith has so much to do with recovery, but so many churches had to close down. So how did that affect you? And then moving forward, are you able to adapt better now for people who maybe don't come into church?
Yeah, so although churches, you know, were not open where people were physically coming in, there was virtual space that people were able to, make that contact. And a lot of the work, particularly within churches, is that we're also working with churches to alleviate the stigma. So there were also some things that churches were doing for their own congregants virtually to help them to cope. My church particularly, we started a mental health piece on Saturdays, which was all about coping and helping people, and they could actually, come there into that space, and there were actually therapists there to talk with them, to help them cope. And some of this work, I think that will stick is just that churches will be more open to receiving, and even in some of the dissemination. Many places of faith were places that disseminated, face masks and hand sanitizer and things like that, offered meals. And there were people that we know that were, in active addiction that were showing up, but they were still being able to get fed. They were still being able to get a message of hope, a simple sign that we care. There were churches that went out and actually distributed things on the streets to people. So I think some of those things, they will continue. And this was actually a great time for places of faith to realize something we've been saying for years, that buildings are not the church, but people are. And so we have to get outside of our four walls.
Thank you.
All right, thank you, everyone.
And that would conclude our questions from reporters.
Okay, well, thank you again. I do want to note something that's become to me very obvious, that there's a partner that's not on the call, and that's the community. So as we all work desperately to reduce stigma and to create connectedness amongst all the people in this community, community members, organizations throughout Hamilton County have stepped up. And so I just do want to say that the collaboration only works because the community is willing to embrace the work that we're doing. And as we morph into, as has been said, not arresting people that suffer addiction, but rather treating people in a humane and dignified way. And you can see our systems responding to that approach. It takes a community to do that work. So thanks again to all the HCR members, Megan in particular. Thanks for putting this together and organizing it along with Alex. So, and thanks to the press for helping us spread the word about HCR and what we're doing in this community related to addiction. Thank you.
Thanks,